kids head back to school, many parents will be resettling into their daily routines, and that includes focusing on healthy habits, from lunchbox choices to after-school activities. Many factors can affect a child's weight and overall well-being.
This morning, we're taking a closer look at how parents can build a healthy balance. Dr. Vibha Singhal is a pediatric endocrinologist with UCLA Health. That's a mouthful.
Yeah.
But, I think this is such a great topic, especially as we are going back to school. And I think it's a delicate topic for parents because, how do you have the conversation? You look at childhood obesity rates are the highest they've ever been.
Soaring.
20% of kids and teens ages 2 to 19 struggling with this issue. So how do parents actually have the conversation without making their child feel less than?
Absolutely, absolutely. And I think it's about health. It's not about a body shape. It's not about a number on the scale. It's about how we can be healthy. And parents are the biggest role models for children.
Sure.
So modeling right meal times, going to family exercise, get together, let's hike together, let's move together. I think that's the best way. And parents just being aware that this is a concern, but not a stress.
Right.
And there is help available, I think, is the key thing.
Why are we seeing obesity rates so high in children?
Yeah, it's very complicated. It's multifactorial, as we like to see, many causes. Processed foods, sugar-sweetened beverages, more times on their screens, and lack of physical activity overall. And I think general stressors. I am a strong believer in like good mental health feeds into like depression and obesity, talk to each other.
They all go
so
together.
all these factors play a role on top of our genetic predispositions. Some of us are more likely to develop obesity than others. So,
well, I just think about a lot of the kids in my life, and how do you balance though too? Sometimes there's this idea like, well, kids get a little chunky before they have a big growth spurt, so he'll be fine or she'll be fine. Is that okay, or do you? No, that's not a thing.
And we used to believe that. More and more data, I think, suggests that you grow with your weight.
Right.
And the higher you are, where you start, the higher you end up. So I think it needs attention. It needs awareness. That is the key. And more important, even early on. The early we treat it, we need smaller things. We need smaller behavior changes.
How do you address this, though, and make sure kids have a positive self-image? Because it's a difficult thing to say to a child they're obese or dealing with weight issues. How do you address it and not address it at the same time?
Yeah. No, first of all, I think being very aware of our own stigmas and not using words like fat.
Yes.
Right.
We've eliminated that word in our household.
Yes, yes. And it's like, I can't tell you the number of stories I hear from teens and children where, and well-meaning parents.
Right.
Friends in school,
Right, of course.
It's a tough space.
Right.
So again, focusing on health, how it's going to, when I talk to my patients, I will say, what do you want to do? I want to dance. How can moving more, eating healthier, improve your dance skills?
Right.
So focusing on what matters to the teen and then going from
What if you start seeing kind of the pendulum swing the other way, where they're starting to get really obsessed with exercise or really obsessed about what they eat, or they're not eating?
That's why I think staying in touch with your care provider and parents being aware is so important.
It's a joint effort.
It's a joint effort. It's totally a family effort. In our age group, it's family-based management.
Which makes sense because that's who's feeding the children.
Right.
Exactly.
So you can only eat as good as your parents feed you. Yeah.
I know, but there is a thing, and I've talked with other mothers about this, that it's a different generation where sometimes the parents eat one meal.
That's true.
And the kids are refusing to eat that meal, and you serve them pizza, burgers, hot dogs. So it is having to get everybody on board, really.
Correct.
I do have one question for you, because this is happening in my life with a friend of mine. Her daughter, taken her to a nutritionist, gets her out to exercise, has done all these things. They are looking at GLP-1s, and she's a teenager. Is that okay?
Yes, GLP-1 is our own hormone, now FDA approved after the age of 12 to be used
after the age of 12.
12.
And it's safe for children that young.
Studies show we don't have decades-long data,
Right.
but we have enough data. So balancing the risks and the benefits.
Really?
What
And
are
when-
some of the risks for a child at 12 years old?
The most common side effects are nausea, right? And
Right.
again,
Okay.
overusing, the appetite really goes
Yeah.
down.
Right.
So we have to
Then
make
watch.
sure that
Sure.
they're drinking enough water, getting enough protein, they're still building their bones, all that good stuff. So I very, very strongly will say that do it with the right medical
Person.
care team.
Yes.
It's
Sure.
not a cosmetic.
Yes.
It's not a trivial thing,
Yes.
but it is a good tool when
Yeah. It's
an
used in the.
option.
It's an option.
Well,
Definitely
thank you
good to
so
know.
much for being here. This
Yeah.
is such a fascinating topic to me, and I think
Thank
it's
you.
so
It was
important.
a pleasure.
Yeah, thank you for
so
being
much.
with us.